how we can improve mental health and well-being in our cities this morning, because that is the question being discussed at a breakfast in Auckland, which will also see Christchurch's Mayor share some of the lessons learnt from after the earthquakes. Te Pou Chief Executive Robyn Shearer and Dr. Arthur Evans from Philadelphia's Behavioural Health Department are both with us this morning. Good morning to you both.
Good morning.
Robyn, maybe if I could start with you. We do have pretty terrible suicide statistics in this country. Is this a problem that we're not giving enough attention to?
Well, if you look at the statistics, 1 in 5 New Zealanders have a mental health issue. And it was interesting coming in this morning, 3 people that were spoken to said, we know someone with a problem. We had over 160,000 people access health services last year with a mental health problem, but we think that's probably the tip of the iceberg. And our health services are stretched. So we're looking to promote other solutions that can be used, and Philadelphia can tell us a really good story about some of those solutions.
Well, Arthur, that's probably a good time to bring you in here. Sure. What is it that you're doing in Philadelphia that's so revolutionary?
Well, first of all, thank you for inviting me to be here. Well, what we've done in Philadelphia is to really try to take a whole population approach. One of the challenges in mental health is that often systems really around the world focus on only people when they are in crisis or at the late stages, and it would be akin to having a healthcare system that only focused on people in stage 4 of cancer. We wouldn't do that for health conditions. We don't want to do that for mental health issues as well. And so what we've really tried to do is to work, as we say, upstream, to try to get to people earlier, to try to educate people so that they know how to access services, and to try to reduce stigma so that when people do have challenges, they're willing to go and seek out help.
So what sort of results have you had from taking that approach?
Well, I think we've had some great results. For example, we've had more people accessing services over the last 10 years, and we've really been doing this work over the last 10 years, and each year the number of people accessing services goes up. We've had fewer people going through crisis, in other words, that people are coming in at an earlier stage. We've had people who now recognize the impact of trauma. You're going to be talking about, one of the things we'll be talking about in the breakfast is Christchurch. And one of the things that we know is that when people experience traumas, whether they're natural or man-made, that there's a psychological impact. And often what happens is it's ignored until there's a crisis. And so we're getting to those people much earlier.
So was there anything in particular in Philadelphia that had sort of pushed things towards a crisis point? Was there anything that made you say, we really need to start looking at mental health differently?
Right. It's a great question. Really, I think what happened is a growing recognition that if you look at most issues in major urban centers, or actually in society in general, that there's almost always a mental health or an addictions overlay. So if you look at homelessness, if you look at child welfare issues, if you look at any number of issues, the children who are in school who are not doing well often have a mental health challenge. And so what we recognize is that if we're going to really improve the overall well-being of people in our communities, it was that we were going to have mental health strategies in lots of different places, not just treatment programs where we ask people to come.
So, Robyn, you guys are going to be talking a little bit about Christchurch. Is this about what they got right there, what they got wrong there? What can we learn from how we dealt with the mental health challenges that is thrown up by something as overwhelming as earthquakes?
The lesson that Leanne will talk about on Christchurch is don't wait for a natural disaster before you intervene and start thinking about what your community response to mental health issues is. And clearly not everyone needs health service, but the community intervention, a bit of education, just someone to talk to can actually be really useful and prevent people getting worse.
You're bringing together, business leaders, central government, local government. What kind of response have you had from them? How much do they acknowledge that they need to be part of the solution as well?
Yeah, we've had a good response. It'll be interesting to see what happens after this. So, I mean, this breakfast is about an opportunity to get to know some of those city leaders and promote some of the programs that we have available, such as Mental Health 101, where businesses can actually find out what they can do for their employees. So after we have the breakfast, we'll stay connected.
Arthur, what about businesses and local government in Philadelphia? Because I suppose traditionally approach this as, like you said, this is just the health sector that deals with that. And once
Right.
you get to that point, you admit people or you medicate people.
Right.
But do businesses get involved and say, we need to help here?
Absolutely. One of the things that's exciting in Philadelphia is that we've moved away from this black box approach, which is waiting for people to come to the treatment programs, to an approach where we're in the communities, in the places that people show up. So one of the groups, for example, we have a similar program, Mental Health First Aid, which was actually created in Australia, where we're training people across the community. So the business sector has really stepped up. The hotel community, where they see that their employees are dealing with people who have sometimes challenges, they recognize that. But we've used that strategy across various sectors, including the business world, the faith community, throughout educational institutions, because what we're trying to do is raise the mental health literacy in the community, reduce the stigma, and increase the likelihood that people are going to get help when they need it.
Which all sound like really positive initiatives. Good to have you here this morning, Robyn Shearer and Dr. Arthur Evans. Good luck with
Thank
the
you.
events
Thank you
today.
very much.
Thank you.
It is 10 to 7. We're going to